splints and tractions or any instrument is a sure question for 3 marker. Okay, then 3 mark other might be something related to spine. Yeah, even in 5 marker you might get, but something related to spine, a question has to come. A question something related to soft tissue, for example tenosynovitis, trigger thumb, then golf elbow, tennis elbow. All these questions are very important and should be asked for 10 marker, sorry, 5 marker or a 3 marker for a fact. Whenever you sit in a OPD of an orthopedics, these are the things which you encounter more after fractures. So an idea, a sound knowledge of soft tissue injuries is a must, not only for your exam but also for your practice. Okay, then obviously one question related to metabolic diseases like rickets, clinical features of rickets, x-ray features of rickets is important. I have made it in a tabular way so that if you present you can fetch the full 3 marker which you want. And something related to fracture, for example complication of a fracture, non-union, malunion, or any complication of a fracture for or for any other things, for example Volkmann ischemic contracture. All those things are also important. We'll discuss accordingly. We'll place the disease like how we did for medicine, and we'll go about it so that we don't waste a lot of time a day before exam, and also we give some amount of time to surgery paper too, so that we can score good marks in both the papers. So this is the general overview. Make sure you study this part first, then you go for this. See, again I want to talk a few things about poliomyelitis and cerebral palsy. Though these are these are included in competency, not much of the questions are being asked. So make sure you study something about cerebral palsy and poliomyelitis. Okay, something. Okay, so that you never leave any question blank. That's it. Okay. Okay, coming to, we will follow the same approach. 10 marker bar 5 marker is predictable, so work for that. 3 marker is on the day of exam, provided you have a good knowledge of whatever orthopedics you have studied in the whole year or remaining 3 years. So fractures, these are the questions according to Singhi and your Maheshwari. And musculoskeletal infection, these 2 lessons has to be covered. And under TB 23 part of your Maheshwari, and metabolic bone disease, it's 17 if I'm not wrong, and bone tumors is 28. Congenital lesions, these are the questions. Those 6 units are included. We feel the most important one are acute osteomyelitis, POTS, spine, and bone tumors. And also under fracture, these are the only 2 questions which we are expecting for 10 or 5 marker. That for 10 marker, 5 marker can come anything. You can expect anything. That is supracondylar humerus fracture and posterior dislocation of it, or congenital lesions of CP.